My name is Brian Silvers. I live in Bedford, Texas. I had double hip replacements, also known as bilateral hip replacements, on July 29th at the Baylor Joint and Spine Hospital. My operating surgeon was Dr. J. Pond. Prior to my surgery, my hips were impacting my life in everything that I did. So this goes back, I was basically in denial for about 4 years. The first thing I noticed when I started having hip problems was when I went to go put my shoes on, I could no longer reach down and actually touch my shoes. So I'd have to contort, I had to start contorting myself into these crazy positions to get my shoes on, and that whole process of getting my shoes on was this big ordeal. So by the time I got my shoes on, I was already exhausted. My lower back started hurting. It hurt. I could no longer sleep on my sides because I always had this like constant aching pain on the sides of my hips. Walking long distances, like a mile and a half, started hurting. It was just really excruciating. It's a hard pain to describe. It was like an aching, kind of just constant aching pain. I wasn't taking any meds for it. I just thought, I was tight. I was in such denial. I was thinking I was getting older. I was tight. I was just getting tighter, and that if I went and worked out some or went back to Jiu-Jitsu because I had some time off from a torn rotator cuff, that would kind of fix itself out. So when I started going back to Jiu-Jitsu, this was 4 years ago, it was just pure agony. I was just grunting through everything, and so in hindsight, the pain that I was going through, I was in complete agony all the time. I just gotten so used to it that compared to now, there's no comparison. How I decided it was time for surgery, there's a couple students at Jiu-Jitsu that were in our school for chiropractic. They're running this special that I went in. They were doing this just range of motion stuff, and he had mentioned that I was like the worst, tightest person he'd ever seen, and he called in his teaching instructor, and the guy kind of turned my leg in a few different ways, and he's like, hey, he goes, man, this sure looks like a joint problem. And from there, that's when I started getting worried. I went and saw my general practitioner. He did x-rays. He came in the room, and he's like, man, he had this look on his face like he was all like nervous. He's like, you need to come look at these x-rays. And I was like, oh, great. He's like, don't come in the room and be nervous because you're gonna make me scared now. So I went and looked at my x-rays, and they're like, they looked bad. It was basically my hips. My hips were already touching the bone, and my leg was already touching. There was nothing left. And he's like, you're gonna need surgery. There's no way to correct this without surgery. So at that point, I went and scheduled myself with like an orthopedic doctor to get a little bit more assessment of what was going on. And they took another set of x-rays, and he came in with the same exact type look on his face, that worried look. Like, he's like, man, your hips are, what's going on? Why are your hip? He was like asking me why my hips were so bad, and I was like, I don't know. He's just like, how much pain are you in? And at that point, I would kind of manage my pain by working out more, and it would give me some relief in the pain. But I'd gotten so used to it, I would just say, yeah, I'm in just a little pain. And he was just like baffled. He thought I'd be in just like morbid pain because of the way my hips looked like. So he said, since I wasn't in so much pain and I was too young to get hip replacements, that I should wait as long as I could. So I wasn't really happy with him. So I would gone home, and I'd called one of my friends as a nurse, and I asked her for if she knew of any doctors. So she recommended this guy, Dr. Pond, in Arlington, Texas, that had done her rotator cuff repair. So I called up the medical group that he worked in, and I scheduled an appointment with him, and he was booked up for a month. So at this point, I'm freaking out. I started doing a whole bunch of just research on the internet, trying to figure out, what my options were. Because for me, it was like the only people that get hip replacements are are old people, right? And then I was like, well, basically I'm not going to be able to do jiu-jitsu anymore, kick ever again. I mean, it was, at this point, it was so bad, my hips were deteriorating so fast that I was pretty much tripping over curbs. You know, I couldn't even pick my leg up to get over a curb because it was progressing worse. So by the time I had gone in and see Dr. Pond, I was doing research on the internet, and I ran across the BoneSmart site. I made a post in the pre-op area, and I started reading through a lot of the forums, and I was like, hey, I'm a 41-year-old, I enjoyed martial arts. I didn't want to stop, and I hadn't stopped after that point because I wasn't going to let, at that point I wasn't going to let, something stop me from doing something I enjoy, but I was just in a lot of pain doing it. So I made some posts, and I said, will I be able to go back and do some of these things? And the people at BoneSmart were great. They gave me a whole bunch of other people that were around my age that had hip replacements, and I started browsing through the list, and I soon came to find out that people can need hip replacements in their teens, 20s, all age ranges, and it's really not a an older person's type surgery. So that was a big godsend for me because it lifted that anxiety and that worrying weight off my shoulders. So I met with Dr. Pond, talked through everything. I liked what he said. I scheduled the surgery. I went through all the stuff on BoneSmart, which I pretty much knew. I knew everything by the time I went through the pre-surgery classes. I knew everything that they were basically telling me from the BoneSmart site. So it was a really great resource. The day I woke up from the surgery, my arthritis pain was gone. So, and then I was off my walker by the second week. I was off my pain meds by the beginning of the third week. About mid-third week, I was already driving. I initially had in-home physical therapy, and I was accelerating through the physical therapy so much that they recommended me to start doing outpatient, at an outpatient facility, and I started that, and I was driving myself to it by the third week. I was already doing half days. I work from home. I'm a programmer. I was already doing half days by my second week, when I was already back to full-time work, by the third week, and just every week has been getting better and better. It'll be 12 weeks Monday, and I'm already back in Jiu-Jitsu. I'm already doing some light grappling again, listening to my body. I'm happy. There's no comparison, and I have no regrets whatsoever. I just can't believe I grunted through it for 4 years before in hindsight, I wish I would have gone and see the doctor earlier, but I'm very thankful for how everything turned out for me. My name is Brian Silvers, and I'm a BoneSmarty, and I have my life back.